Hi, welcome to Future Nurse YouTube channel. Please subscribe and support my YouTube channel. So let's get started. Number 1. The lobe of the brain that can decode and interpret visual information. So the options are temporal, frontal, parietal and occipital. So the correct option is occipital. So the lobe of the brain that can decode and interpret visual information is the occipital lobe. Let's move to the second question. Which of the following techniques are examples of non-therapeutic communication? Options are giving advice, focusing, restating, paraphrasing. So the correct option is giving advice. So move on to the next question. Disposal of expired and cytotoxic drugs is by. So how do you dispose the expired and cytotoxic drugs? So options are autoclaving, municipal waste, chemical treatment, separate landfill disposal. So the correct option is separate landfill disposal. So by separate landfill disposal, you will dispose the expired and cytotoxic drugs. So move on to the next question. Which of the following is a differentiating test between mucus and CSF from a nasal discharge? So they are asking the differentiating test between mucus and CSF. So the options are specific gravity, protein, microorganism and glucose. So the correct option is glucose. So move on to the next question. Question number 5. The junction at which an impulse travels from one neuron to another is called as. Options are stimulus, nerve message, synapse and axon. So the junction is called as synapse. So option C is correct. Normal range of ICP is 0 to 5 mm of Hg, 5 to 15 mm of Hg, 5 to 10 mm of Hg, 15 to 20 mm of Hg. So the normal range of ICP is. So the correct answer is 5 to 15. Next question. Which among the following is most commonly seen in a client with C6 injury? So when the patient is having C6 injury, so what do you see? Option A, paralysis, hemiparesis, quadriplegia and paraplegia. So the correct answer is quadriplegia. VP shunt is the surgical management for. So they are asking the VP shunt is the surgical management for which of the following conditions? Spina bifida, brain tumor, hydrocephalus and AST. So the correct option is hydrocephalus. They will use VP shunt in the management of hydrocephalus. In CSF pathway obstruction at aqueduct of Sylvius cause enlargement of. Options: lateral ventricle, third ventricle, fourth ventricle, both A and B. So the correct option is lateral ventricle and also third ventricle. So the correct option is both A and B. Next question. Transformation another differentiated cell type is known as options anaplasia, metaplasia, hypoplasia and aplasia. The correct option is metaplasia. So metaplasia is the right answer. So move on to the next question. Which among the following is not present in tumor lysis syndrome? Which among the following is not present in tumor lysis syndrome? So the options are hyperkalemia, hyperuricemia, hyperphosphatemia, hypercalcemia. So which condition is absent? The option is hypercalcemia. So hypercalcium is the correct answer. Which of the following anti-tubercular drugs is contraindicated in a pregnant woman? So those who are pregnant ladies. So which TB drugs is contraindicated? So the options are pyrazinamide, isoniazid, rifampicin, streptomycin. So the mainly drug which is contraindicated for a pregnant woman is streptomycin. Please remember that is important. A positive over the counter pregnancy test is considered as. The options are possible sign of pregnancy, presumptive sign of pregnancy, probable sign of pregnancy, positive sign of pregnancy. Correct option is positive sign of pregnancy. Purpose of doing bimanual compression of uterus is to prevent APH, prevent PPH, prevent cord prolapse, improve the descent of fetus. So what's the purpose of doing bimanual compression of uterus? So it's mainly used for to control PPH. Prophylactic treatment started after exposure to HIV virus. So the options are within 12 hours, 24 hours, 48 hours and 72 hours. So the correct option is 72 hours. So you should start prophylactic treatment within 72 hours. Move on to the next question. Term used to define when two organs are present in same side of the body. So when the two organs are present at the same side of the body, it's called as. So the options are bilateral, unilateral, ipsilateral, contralateral. So when two organs are present in the same side of the body, it's known as ipsilateral. In human body, glycogen is mainly stored in thyroid gland, kidney, liver, intestine. So the glycogen is mainly stored in liver. Application of drugs on the skin by local rubbing is called as instillation, inunction, insertion, insufflation. So the correct, so we'll see the correct option is inuntion. So inunction is the correct option. Which of the following quadriceps femoris muscles help in flexion of the thigh? Options are rectus femoris, vastus medialis, vastus intermedius, vastus lateralis. So the correct option is rectus femoris. So this rectus femoris which help in the flexion of the thigh. The appropriate needle size for insulin injection is 18 gauge, 22 1 inch long, 22 gauge 1/2 long, 25 gauge 5/8 inch long. So we'll see the correct option. So now let us see, for diabetic patients they need insulin injection. For that we need to have insulin syringe which is having needle size 25 gauge. The surgical removal of entire eye along with a part of the optic nerve is termed as keratotomy, enucleation, keratomylosis, vitreoretinal surgery. So the right answer is enucleation. The theory of operant conditioning was experimented by William James, Ivan Pavlov, Harry Stock Sullivan, B.F. Skinner. So the correct option is B.F. Skinner, who invented the theory of operant conditioning. Finding a logical reason for the things that one wants to do, sour grapes mechanism is projection, rationalization, identification, sublimation. Those who want to do sour grapes mechanism is called as rationalization. The defense mechanism which return to the earlier developmental stage is, so the options are regression, repression, projection, rationalization. So the correct answer is regression. Most common complication of ECT is antegrade amnesia, retrograde amnesia, psychosis, depression. So the major common complication of ECT is which is called as retrograde amnesia. So this is the right option. So we have come to the end of the video. So we will see next another few questions. So previous year questions in the next video. So please subscribe our YouTube channel. Thank you.